Holy shit. I always come back. Freaking Pata. What's up? How are you doing? You've been busy, I've seen. You're good. I figured you were busy with studies. Here, let me restart this. And I'll pick this one, air water syringe. But hopefully you did well. I know you were, I know last time we were talking, you were in the middle of editing a video, getting it ready for your group or whatever it was. So hopefully that went well, or maybe if you turned it in yet. Open project. Air water syringe. Where's it at? There it is. This is stupid. You're too funny. I need to. I've been working on the back rooms one so far. I need to get a little bit more footage, a little bit more cleaner things, but I've gotten. I just need a different hallway or a different angle from that same thing, and I just need to create the repeat of the hallway. So it's hopefully it'll be fun. At the moment, all I'm doing right now is I need to take some of my videos that I have, and I need to make them into small little shorts or little 30, 60-second clips so that I can push them up in the meantime, so no one, so all the dental people don't forget about what's going on here, potentially. So I need to locate all my project files and just slice and dice some of the things that I got going on here. Where the hell's that video at? There it is. Projects, air water syringe repair. There it goes. All right. Did I already do one? Is this why it's not... Do I not have this memorized that I already made this one into a short version? How would I look at it? How would I look this up? Not post, not lives. do I identify my short videos? No, not that. Oh, I could just go to my channel. That's what I could do. Shorts. Do I already have one? Or was that the introduction to it? Let's see. 1 second. I need to listen to one of my videos here real quick, see if I actually got it all. I feel like I did a short version of this one already. Blah, blah, blah. This is its intro. I wish I could scrub this video. Oh, I did do this. Okay. Okay. I did already do this one. Good. Okay, so that's good. I did that one. I did that one. I like how I did this. Leaky Airwater Syringe. Do I have the file format for that? Or did I do it? Oh, I remember, that's right. So that was good. Okay, so I did braces. I did that one. Dental students. I should do another crazy dental students one. Did I post that one to TikTok? Let me see. View profile. Oh, something went wrong. Refresh. Yeah, that one didn't take off really. Everything about alginate. Sorry, I'm kind of flipping through everything. Oh, hold on. Exciting news stuff. Oh, hey, all right. They recruited me into a team for Identity 5. I'll explain to you every January there's a call called COA, where teams from different teams try to be number one. Play identity normally and competitive is very different. It is much more difficult and much more difficult and more for hunters. Well, I could imagine that can be a tough one, especially since these are the top survivors that are just have everything down. So that's insane. I can't even imagine the frustration that would probably happen off of just that. But congratulations, your dedication and your skills definitely show as far as everything that comes in here. I changed to mention that there is talk of somebody being number one. Oh, that's super cool. That is awesome when it comes to that. Um, at, at least that work that you've been putting in has been is hopefully it'd be nice if it paid off. So super awesome. The difference is that the survivors are communicating and creating strategies, and that makes it impossible to hunt the survivors. So it's like true communication between the survivors. Then at that point, like they actually have, hey, maybe they're in a Discord chat or something like that, making it way difficult. I can see that being like, I can see that being mind-numbingly insane versus just a single hunter just kind of like guessing what's going on. So that's a lot of strategy. That's a different level of play. Holy, like you mentioned, super super different. Oh, it did better over here on TikTok. Okay. Hmm. Oh, that's so cool. I already have my couch and captain. Training is done tomorrow. Oh my gosh. That is super cool, man. That is awesome. I don't think I've ever gone to do anything competitive in any types of games. As far as like really big things, I remember me and my buddy when Halo 3 came out all that time ago. Probably that was probably when I was a junior or probably about junior senior in high school, and I remember us getting pretty good at that. But my buddy went on to do more competitive stuff versus myself. I was doing dental things, so I couldn't do that part. 1 second, let me go and be right back. Alright. Yes, and when it's like that. Sorry about the audio. Dancing all around. Let's see. Training's done tomorrow. Yes, and when it's like that, it's very competitive, and you must know what you are doing. Oh yeah, absolutely. That's probably something they've already kind of pre-screened based off of your wins and your ratios of your account and everything. So you've already proven that. But oh, that's so cool. Shoot, I may know someone that's famous now, which is super awesome as far as that happening. But good job, man. Let's see. So I don't need to turn this one. I don't think I'm gonna turn this specific video into anything because I've already did it. Yeah, I already turned this one to a short. So I don't need to do this video. I need to go and work on another one. Open project. Let me go and see another video. I'd like to do that. What's funny is that the team is called Kinder. So that's an oh well. I mean, it's those neat little names that make it recognizable. It's different. Let's see. Let me go and do one of my alternate impressions videos. Location. Locate. And from there, all the way to the bottom. There we go. Completed videos. Alternate impressions. Search. Alright, here we go. Yeah, whatever. Alright, so. I hated this. I think I had like a funny hair thing going on in this video. Oh no, it wasn't this video. It was. I remember I had to redo this one. That's right. Okay. Where do I want to take for this one? this project away. And okay, in the off, I don't need it in the off. Algin impression videos. Let's go here. That is going to be a exciting time to build your reputation in this. Ooh, that's cool. That is actually pretty good motivation. Yeah, I'm pretty sure you have to really stand out apart from your other teammates or from other teams in your pre-trial matches to get these certain things done. But I mean, that's just a neat new thing to experience in this part of your gaming life and everything like that. So that is going to be something that you can remember and take on to your next adventure and be like, oh, I did this. This was super cool, and such on and so on. And we made it this far, or we made it to the top. So as far as how you're getting there, shoot, you're living the part of the dream so far that a lot of us would like to have been in. Get into some competitive teams. So you keep living it out for us. Oop, went too far. Since in COA, the games are classified in points. If the 4 survivors escape, there are 10 points for that team and 0 for the hunter. If it is a tie, 5 points for both, and if one dies alone, it's 1 point. Oh, okay. That's a neat. I guess it's nice knowing the point system that they can keep track of everything by. Do this out. What the hell did I just wrote in here? Transition? Why did I put transition in here? Now that we're ready to go, we have a couple ways that we're going to. Is that built into the video? Did I leave that in stupidly? Let me check out this video that I have. Here's my alternate video. Where the hell did it happen? Where's this transition? Okay, right after I tried in the tray. Where the hell's the tray trying? Right here? Make sure you kind of move it side to side and see if there's enough room in the back. So we have all these I didn't. Hold on. What the hell? What's going on here? But as I said in COA, for the hunters, it's easier for all the survivors to escape. Yeah, I'm pretty sure getting being able to take out all four of them in a match is going to be really hard unless they're just not communicating at all. So that's tough. But I'm pretty sure you guys are getting graded also on what is it called? You how you're able to do in both categories, maybe. But I guess you said it's by team though, so it's just a group effort overall. Where the hell is this compression tray? Where is that? Okay, I guess it's not in this video. What the hell? Why is stuff out of order in this? Maybe it's not. 7 minutes. This must not be the final product then. This can't be. Yeah, this can't be the final product. I don't know why I left all these slides, all these transition slides in. Uh, oh, there you go. Okay, so now another thing. Well, what do you tell me? Let's see. Um, I'm trying to think of a quote that Ansem would say. Um, well, for one, I also need to get back and playing Kingdom Hearts again. Um, shoot, work's been good. It's just been standard. Work's been we're going to transition from one subject of a class to a complete another subject where we talk about all the different specialties of dentistry, and it's one of my favorite ones because there's so many hands-on things that change every single week. We're gonna go and learn. Wow, let that. Wait, where are you going trick or treating with your kids on Halloween? With Halloween, I think what I'm going to be doing with my baby teeth and everything is we're going to go do this little thing for our, well, we'll go to like a community where old people live, and we're going to go do trick or treating over there so that the elderly can see kids and all their little costumes, and the kids can be nice to them and everything. That's always fun to be able to see them smile that they're getting all these little visitors and everything. So that will be our first part of it, and then the second part, I'm going to be passing out candy, and of course, I have to pass out other things like floss because dental person weirdo and everything. I do need to put decorations out on my lawn, and usually I end up putting a projector on in my driveway, and I project like spooky things on my garage, and so that's always a fun thing to do is to project and do all that stuff. Um, so that's what I'm hoping to do. It's looking like it should work out, but I want to figure out what to put up on the garage for this to happen. because usually if I'm gonna go trick or treating with the kids, uh, like this year, just like last year, I'm just gonna wear my tooth costume, and that's always fun. But I think this year we're gonna take it a little bit easier. Do a little trick or treating around my neighborhood, and then pass out candy. No one likes coming down our little area though, so we don't get a lot of traffic. But I figured if I make it big, or if I can make it bright enough that people looking down the street can see, oh, they're doing something over there. Maybe they'll travel over, get some candy, get some floss, get some dental advice, and go from there. But who knows? Maybe I'll put on the projector onto my garage and play some spooky games while I pass out candy. Maybe even playing like spooky mansion games or something like that. I thought it was a Halloween phrase. I never took the time to translate it what it means. Oh, that's cool. I get it. It's nice being able to hear. It's nice to be able to run through your brain on some of the things that are changed from our cultures. Yeah, trick or treating is fun to say. It's fun to say. It really is. Thankfully, it's not too many tricks as far as like people uh, messing up your front yard or throwing eggs at your house or anything like that. Thankfully, that has been less and less throughout the decades. But I think it was last year. It may have been 2 years ago. Let's see. Yeah, I think it was 2 years ago. Um, I mentioned it before. There was we were walking around doing our candy hunting, and there were these probably teenager kids that went and did something to this one car that was down the street and somewhere, where I think they went and popped three of the four tires, and then threw an egg on it, and then ran. And this all happened as me and my family were passing by, but they were on the opposite side of the street doing that to that car for some reason. Never knew why. Um, and so as they did that and ran, of course, no one knows what's going on, but they were teenagers. No clue how old, but that was definitely a messed up thing to have done. But it's kind of the risk that happens during that time. Let's see. I need to. I don't. Let me see. Let me close this project. I'll save what's going on here. I need to open a new project. No, nothing in here. No timeline sequences. Why is this saying? That's weird. Weird. Why didn't I use that one? Yes, I do need to play Spooky Mansion. I've been waiting patiently to get the okay to do it. So you let me know, and even imagine how many times you're going to jump out of the chair seat because of fright. That's so jacked up. I have no clue what I'm in for now. Why didn't I use that photo? Hmm. Hey, let me close this project. That one's not working right. Repair air water syringe. Let's close this project. Open a new one. Yeah, but that one's gonna be Spooky's Mansion's going to be. I'm anticipating a fun one for me to try to make it through. So that's gonna be an interesting one. Hmm. Do I still have this? Okay. I don't remember still having this video. Search. Oh, I do have some. Oh god, I do need to finish this one. When did I record this? Record this ages ago. Okay, yeah. Don't want to start that one yet. Yeah, save that. Oh, hello. This is a hell of a niche. Oh, sorry if I missed your thing. This is a hell of a niche. nice to meet you. Hello, or Carlos, whichever you want to be called. Yeah. I mean, oh yeah. See you in a sec, Pada. But yeah, if anything, if you have any dental questions or anything, just let me know. Typically, my deal is to talk dental. I'm editing dental videos. It's kind of a thing. Let me know about it. Let me know what's going on. But don't worry, I've seen quite a bit out there. It's just odd enough that people, it's just odd enough that also on your side that you were like, oh, some weirdos talking about teeth. Let's go click that thing. It looks okay. So in that aspect, you're probably mean like everything feels like crap, but it looks fine on the outside. Or maybe just like the anteriors, the front ones are a-okay. The rear, the posterior, is the ones that are taking the main force. Let's see. Let's see. There's like starts a cavity, and that happens an irritation to cold and hot where I have a crown. I have a Skittle nightmare. I had a Skittle nightmare a few weeks ago. Skittle stole my crown. I it's funny that you bring up the Skittles because as a dental professional, I must as a legal thing have something always nearby to counter what I do in the field and everything. So I always have to have sweets nearby for some reason. But let's see. Let's see. Where does it all start? The sour ones got me. Ooh, those are my favorite. I love sour Skittles. They're so damn good. But let's see. Starts cavities and irritation to cold and hot, where I have a crown. Had a Skittle nightmare a few weeks ago. Skittle stole my crown. Bad self care dental wise. And you know what? And you know what? I was in the same spot. I don't. Not many people are in very great situations where they didn't have something to go, something that they went through, especially in their past. Like, I was a terrible kid. I did not brush my teeth, and I paid for it in visits to the dentist. And that kind of worked in my favor because me going to the dentist so often at a young age, I got to see what goes on, and that got my interest peaked. And then I wanted to get into dentistry, and I became a dental assistant, and been doing it for 15 years or so. So I've gotten to relive and go through everyone's experiences and see how it is now. And I have my fair share of metal fillings all over up in this mouth. So don't worry, we've been there, or at least whoever you talk to can relate to that, to those pains and those issues and such like that, like myself. Um, let's see, hot and cold sensitivity, like you're mentioning, where I have a crown. That's kind of, so you have a crown, a cap, essentially what a lot of people call it on the streets and everything like that. It's weird that you would have that sensitivity happening to there, to that spot, because a crown should cover the whole entirety of the tooth. But if there's like open margins, or if the gum has receded a little bit, allowing a little bit of real tooth to peek through, that's where I would usually see sensitivity coming from. That mostly. Um, and if it's and like you're mentioning, if it's a hot slash cold sensitivity, it might just be that there's um, some exposed parts of the tooth that are just sensitive. Maybe not like a cavity sensitive, but maybe that. Gum did recede a bit as I was told, but only the top, like 3 millimeters or something. Ooh, look at you coming out with the correct measurement style too. What we use in the field and such, in millimeters and such. But only the top, like 3 millimeters or something like that. Let me see. In those cases, they may have told you, especially if it's just a temperature, a thermosensitivity, then a couple things that you can do, and they probably already told you this. Get sensitivity. Get a. You can do this with regular toothpaste. It's a little bit quicker with sensitivity protection toothpaste, which is like Sensodyne. But if it has a lot more. Oh, thanks for following, Carlos. If it has a lot more fluoride in the toothpaste than normal, this is what you do. Just take it after you're done brushing your teeth and everything. Just take a little. Just take a. I want to say splooge. That's super wrong to say that. Take a dollop of that toothpaste and just roll it onto the gum lines. I know, right? It's just stupid. Don't worry, I got that one there. Just roll it onto the gum line where that sensitivity comes is at. Don't brush it on. Just let it sit there and just, like I mentioned, let it rock that spot for a long time. Especially if you're able to handle the taste and everything, it's gonna feel taste minty. Just let a layer of that sensitivity protection toothpaste just sit there and go to sleep or go throughout your day. Another thing to do in these little spots is if you're able to get access to either a, um, what is it called? Be able to get access to like a custom tray, like a whitening tray, or even if you get like a mouth guard that you can kind of custom mold to your mouth, which will suck because if you're going to custom mold it to your mouth, it's got to be warm or at least coming out of warmish water. And then put toothpaste in there and wear that mouth guard for long periods of time. You'll notice that probably by, if you're using sensitivity protection, by half the tube to about the full tube, you'll notice a desensitizing effect on your teeth. It's because those at the edge of the tooth, like you mentioned, where the receding gums, yeah, where the receding gums are happening. Underneath that, there's a small part of your root of the tooth, which is called your cementum. And with that cementum being exposed a little bit, it has little nerve endings that are firing whenever it comes and gets hit with any of this thermal stuff. And so, because if you go and leave a layer of toothpaste on there, that layer is going to twist those nerve endings so they can't fire anymore. And now that they can't fire as often or anymore, your sensitivity goes down. It'll take a lot. It'll take a lot higher of a thermal sensitivity, so like a super hot coffee or like ice on that spot for you to get a trigger effect anymore. But for the most part, that tends to be a way to do an over-the-counter version of desensitizing. If you do end up going to your dentist and they're like, "Oh, we can't help you out," ask them about a fluoride treatment. Doing a fluoride treatment might come out cost out of pocket, where they'll put a fluoride tray on your teeth with very super strong fluoride gel or foam, and that will help get sensitivity lessened way faster because the material that they're using is high concentration. As far as that, but your main way to combat sensitivity, especially if it's not a cavity, is fluoride. Fluoride out of toothpaste, or fluoride varnishes, or fluoride gels. But essentially, that's what you would want to do with those. But I'm glad you had that question. It's actually a very common one that people tend to go through. Is tooth sensitivity like that? And a lot of time it comes down to how we're brushing. Are you using a medium or hard bristle toothbrush? And if you are, then switch to a soft or extra soft. And you might feel like that doesn't feel like it cleans enough. Just use a little bit more time of brushing, or a little bit more pressure and time. But if you're using medium or hard, that is going to injure the gums little by little, causing them to recede more and more. Even on the other side, as we get older and older, those gums recede and recede. So it's always a fight to keep things uptight, to make sure that everything's working well. So how feasible is it for someone to, let's say, with fine teeth in the future, to get them replaced with something that doesn't rot or tarnish, or whatever the word is? Weird question right there. Let's see. So in the case that I'm thinking that you're mentioning, as an example, already saw Twitch. Oh yeah, I don't have the Twitch stuff coming up, or it's over here off on the side. I need to shrink that down and pull it over side. Thank you, Prada, for letting me know about that. That Twitch was weird. My Twitch chat was weird. Okay, so Carlos, in that case, when it comes to that, um, what I'm thinking is happening that you're mentioning is people getting their teeth pulled out and a denture made for them. I'm not sure if that's where you're kind of dabbling into as far as that concept, but that's a very common one for people to say, "Oh, I have like little fires all over my mouth that could be fixed, but hey, just go ahead and pull them. Put me in a denture, where every tooth is replaced, or every tooth is pulled out and replaced with artificial teeth, and then they'll go from there." That's a common one for people to ask that have a lot of things going on, that is a lot of money to fix, and they want to do the cheaper option by just pull and full replace. And that's a that's a tough one for dentists to want to do, because ethically, it's not that it's wrong, it's just not the best plan for people that have minor problems. But if they have so many minor problems that it's not even worth repairing, or not even that doesn't make sense. If it's so many minor problems that the patients just knows for a fact they are not going to repair them, then at that point there may be some more conversations between the patient, as far as trying to keep them, because we want you to keep them. If you do get all your teeth pulled out and replaced with dentures with false teeth, your chewing ability lessens greatly. And I believe it's normally where we had a 100% ability to chew and crunch and crack nuts and chew on steaks with 100% of our force. When you go and take all the teeth out and put yourself into full dentures, just every denture that you put in, one for the top, one for the bottom, each of them takes away, I think it's like 20% of your chewing ability. So maybe now that you took all your top teeth out and replaced them, now you have 80% of your biting force. So maybe now you can't crack something. Or and then if you get the lower ones taken out, now you have the biting force of two fake ones. Now you're at like 50 to 60% of the force that you normally have, and so things get tougher and tougher. Robot teeth won't work then. Need clear coat for teeth then. When it comes to that, oh man, wouldn't that be crazy enough? Oh, you take it easy, Pata. You go and get your rest and become the best Identity 5 player out there. But we'll see you next time, man. And then let's see, clear coat for teeth then. Nice things when it comes to certain things like that. Let me go and switch over for this. Is it Let me go and take this. Sorry, I switched scenes and didn't realize I didn't take this piece out. Oh, I didn't move this piece. Where is it? Here it is. Okay, that should be good. Let me bring. All right, everything should be about fine now. Cool. So what you're mentioning in that whole thing, as far as thanks, as far as like you were mentioning with like a clear coat, in your teeth there are natural cracks in there called grooves, pits, and fissures. Those natural cracks like to gather bacteria, sugars, plaque, all that stuff. And so, in those cases, when we do have those natural grooves exposed, as dental professionals, what is a recommended treatment is to put sealants on teeth that have those grooves. A sealant is like a nice little nice little plastic filling that doesn't require a shot, doesn't require an injection, doesn't require numbing, and they just clean the groove out, make sure it's clean before they put the sealant over, and they'll just go and lay it in there really thin, and that helps with cavities develop. That helps protect against cavities developing on the top of the tooth and on the sides of and on the cheek sides or tongue sides of the tooth. Now that protects 3 out of the 5 surfaces that your teeth have. Your in betweens, your flossing areas, are always going to be the most common ones that tend to have issues. So, um, have to keep flossing as much of a bother as it is. I recommend just getting one of those little floss sticks that they sell like in a pack of like 100 for like $3 or whatever, and just keep a couple of those in your wallet. And then every now and then, when you go and open up to like pay for something, it's like, oh yeah, I need a floss. Pick one of those suckers out, floss on your way to do something, toss that into the garbage, and then get that to become more and more of a habit. Um, so and then also as far as like good times to brush and everything, it all leads into each other, right? Best time to brush is at night. Of course, you want to brush after every single meal as if you can, but if we're all sporadically eating snacks and everything like that, brush at the end of the day so that you go to sleep with nothing on your teeth. And then when you wake up in the morning, you really don't have to brush unless you actually ate something in the middle of the night. And then go throughout your day, brush at night, go throughout your day, brush your night. It's typically the best situation to do if you choose to do once a day brushing. But yeah, good questions. Like you mentioned, super niche. This is what I'm here for. This is what I enjoy talking about is dental stuff while I'm doing whatever gaming, editing videos, making dentures, making things like my tooth ring that I got right here. I love wearing my little tooth ring that I have, but I'm just all over the place. Switch switch that over a little bit. Hmm. Yeah, there's a lot of teeth. I love teeth, as odd as that is. But hopefully, people are able to find me whenever they're in need, and definitely, it's always fun to talk it. Dental always felt very engineering-ish to me. Essentially, when it comes to teeth and everything, all all we did was dentists and everything looked at what the carpenters are using, looked at what the mechanics are using, and we just made it miniaturized to be able to work on teeth. So definitely we took a lot of everyone else's stuff and did that. Love like the thought of 3D printing teeth on the side and scanning on site and scanning it. Oh yeah, that's also a very big thing in the community that's happening right now is 3D printing with 3D printing different teeth stuff. So one thing that's getting into the aspect right now is 3D printing models, impression stone models and everything. Let me bring myself up here. 3D printing models for making like different appliances on. That's a very common thing that's happening right now. 3D printing teeth and then also the denture base and then slit and then essentially cementing or gluing them together is also something that's happening in the electronic space right now. As they are working right now, also doing is crowns, 3D printing crowns, but the type of materials that's being used to 3D print them is somewhat sort of weak. So it's still in the motion of trying to get get that hardness, so it has that durability factor in there. Yeah, I had the laser for the first time as well, which was cool. Oh, the little scanning laser and everything. The We have a couple of them, which is like Ceric is one name of them. 3D Trios is another one of them. There's a bunch of different names. Those scanners are super cool. And because I teach dental assisting, I would love to be able to get one day my hands on a really old refurbished scanner. Oh, that type of laser. That type of laser too. So the other one, that scanner and everything, is just a 3D scanner and everything that works on the teeth. But like you're mentioning, is like a laser that they probably would have used for crown lengthening, where maybe we need to get a little bit more tooth to show, and the gums are way too high up, so they'll use that little cauterizing laser to go and burn away some more material. They probably have you wear glasses so that you don't catch any of the laser light as it comes out or is emitted from that little handpiece of theirs. And then, and then also, unless the dental assistant is super bad at it, you shouldn't smell you'll probably taste it, but you shouldn't smell your gum tissue or anything burning when they're doing it. But that's also something that happens, that you'll just get a whiff of just like burning flesh, burning mouth stuff, and that's always enjoyable to experience once or so. Um, but yeah, there's a lot of things. I was so numbed up, I didn't even have a chance. It's a neat experience. It's a neat experience being on the assisting side and doing that, and on the patient side and experiencing that. But it is definitely definitely a neat little space. It's so odd because like people think like, oh, it's so barbaric. They're just going in there and just tearing that teeth out, or they're going and cutting things, or making stumps of teeth and then jamming something on top to replace it. It's very neat space. Everything's so microscopically done that that it's always a growing field, and all we have to do is just learn about this space. Honestly, going to the dentist is up there in my things I don't want to do, which I figured is common. Oh yeah, and you know what? Same thing with us as far as assistants and everything like that. Once we have been called upon in the office. Say like a patient cancels and they're like, "Hey, who wants dental treatment?" As soon as we hear that, everything goes and tightens up. It's like, "Oh, you're ready. It looks like you have some treatment on your chart. Let's go ahead and get you in the chair." I start clamming up. I don't want to be a patient. So, even being in this field for so long, it's like I'm going to get a shot. It's going to be a block injection. It's going to be on my lower right. This whole section's going to get numb. We just know it so much and we know what happens that even though it's so common for us to assist it all the time, once our butts hit that chair, all of our knowledge goes away. You ever get any weird people when working on them? If you're in there that long, that's got to be some weird stuff. Yeah. Yeah, there's some crazy methods of methods of restoring teeth that some dentists have done in the field. And I kind of say it like that is because depending on the patient's age, we may get someone that got their fillings done from dentists that learned their stuff in the military, and at that point they were like 80 years old using techniques that they knew from the field and everything like that. So really neat stuff as far as, oh, there's a silver point root canal filling in that tooth. Like that's super old. That must have been done in the 80s or and stuff like that. So it's neat being able to like just take x-rays of your patients and knowing kind of their history based off of these little black and white pictures that we got from them. So it's neat. Definitely. Definitely can be weird, but after you're done looking at the tooth that you're focusing on and you look at all the other teeth visually with your eyes, you're like, "Oh yeah, it's kind of crazy." Or you just like it just is a lot of stuff. It's just like medical assistants and everything, or people that look like the medical field where they're like, oh, look at this person's back skin right here. Doesn't that freckle look very odd to you? Why it looks like that and it's that size and the hair growing out of it. So we all have the weird tendencies that we see in our different fields. And I was talking to this girl who was an assistant and was talking about practicing shots on for numbing on other assistants. Terrifying. Yeah, that's something that happens, especially for any assistant that's trying to go to hygiene school to become a dental hygienist. In their schooling, they go through what's called shot labs, where they just go and practice on each other after they learn everything. So okay, you need to go and learn how to numb the lower right, giving a block injection to numb the inferior alveolar nerve. All these dental terms and everything. And so they practice on each other, and it does sound terrifying as far as it. But I mean, just like I mentioned, you see Doc do it so many times, and just based off of that being around them experience, you're just like, that's not that hard. Yeah, yeah, it's not that hard to go through and do some of the things that you're seeing from docs and everything. Oh, and it's okay. It's okay. I like to out to throw a confession scene, and so that we can so that people can release their can speak to us about their tendencies. But it's definitely a weird field. I love it. I can't see myself doing anything else except probably IT. IT for dental. That's what I would probably be doing. Oh, so yeah. Did someone end up telling you that trick? Because that's what usually I tell my patients at that point. I was just like, hey, don't smoke, right? But if you're gonna smoke, take these 2x2s, these gauzes, these 2x2 gauzes, and if you're going to, like I know there's no chance that you're not going to at all. Take them, roll it up to be like a little mesh filter, pop it on that socket, smoke as much as you need to get by, and then replace that gauze as you need to. So that's a good way to be able to kind of keep it protected, act like a filter and everything like that. But it's something. Yeah, yeah. I was chilling, super careful about suctioning. Yep, exactly. So there's tricks to that trade when it comes to it. Oh, I kind of do it as a side job, do freelance programming. Oh, look at that. That's always a that was always seemed like a neat part or aspect of IT that I always wanted to get into because it was always interesting to me, but I didn't want to get into it full time because I didn't want to turn an interest like that into something that I would eventually regret or anything like that. So when it comes to it, I would like to mix dental stuff with IT stuff and kind of find a meld between them to have it all work out. But that's pretty cool. Look at you. Look at you. Well, that's there's definitely, like you mentioned before, there's a niche in the medical fields to be able to produce certain things like that, to make certain protocols and workflows be work as they should, or to be a little bit more shortcut, like that we would like to. That maybe some of our normal programs that we use in the field don't allow us to have or do. So there's a lot. It's a fun for sure. Main job is metal fab. Oh yeah, through though it's the same boat where I've been mixing metal fab and programming. Really fun. Oh cool. So then that's kind of in the same route as using like a CNC machine. Also, I would guess, but maybe off base because especially with that, I mean that was another thing that we stole uh, from other fields is the ability to mill things. So using CNC machines on their side, being able to make crowns and such has been something that's really good. I do have a CNC, but I also created a mechanical device. Been trying to get patents and get patents and get serious. That would be a sick thing to be able to do. Man, isn't that's the dream right there, is to be able to get something going that you can call yours, and hopefully it can put you on the map and have that work. You're good. I kind of connected the dots that were missing because I'm the same exact way when I type. But good on you. That is the way. Yeah, it's the same here. It's nearly midnight for myself, and I want to try to get a little bit of editing in here before I call it quits. But it's also nice to look at you, look at you. I figured we would have been on the same time frame if that is what the deal is. Okay. More I guess you guys would consider it Northern Cal, even though we kind of consider ourselves Central California, but definitely about 80 miles away from Sacramento, essentially. Yeah, we're on the same time zone, you know. But super cool. Usually, like I have people from other places and everything. I have people from other places. Like I have this one guy that comes in from like Norway that comes in on stream sometimes. I have Pata from Mexico. I have a couple people in the middle of the states and everything like that. So we're all on some different time frame. But this is the first time I've had it where we're kind of on the same similar-ish one, so, or we are on the same one. But yeah. Oh, I need. Is this at an eighth? Oh, San Luis Obispo. Isn't that the Bay Area? I'm guessing. Definitely not in the Bay. Yeah, same here. You can like throw out some of these places on the map and I don't even know where it is. But I'm guessing, especially any sand is gonna be somewhere near in the Bay. Bakersfield. Bakersfield. Bakersfield is definitely um, even further from where I land. Let's see. Oh yeah, okay, I see where you called San Luis from. Yeah, it's farther, way farther north in that aspect. Like Bakersfield is like, don't worry, same kind of similar. There's just so many damn towns and regions inside California that there'd be no chance doing it. It's like I know Sacramento. I know a little bit about the Bay Area. I know a little bit about SoCal, very little bit, and like Fresno. Yeah, you take it easy, Carlos. Nice meeting you and everything like that. Always cool to have a new person stop by, but you take it easy. Oh, I still have that on. Hmm. Need to get some more footage then. Let's see. What's this next spot? Oh, some peak rounds? Okay. What's going on over here? Dark hallway. I'm gonna use this one right here then. Boop, boop. Let me go pull this out then. So, with this, okay, do that. Let's throw a mask. Let's see. Ooh, that one's gonna be a tough one. I almost have it though. more footage of that then. This is gonna get good.